a longitudinal section of a female aged 38 years, Paris, and with the history of chronic pelvic pain, no history of any menstrual irregularity. And here we see that this is the uterus in longitudinal section, measuring approximately 8.1 centimeter by 4.9 centimeter, and it is within normal dimensions. This is the endometrial canal, measuring 7.8 mm. So this is the uterus in longitudinal section. Now, Now I'm going to magnify to show you there is a focal lane seen in the posterior myometrium. This is in the submucosal location, measuring approximately 13 by 13.2 mm. It's ecogenic in the center, densely ecogenic, and is surrounded by a halo. Now I wish to see whether it changes its shape or it remains the same. I'm going to give a sweep to the probe, and you can see that it does not change its shape, it retains its shape. So this is not endometrial canal. Now these two, if I show you these two together, now this is the one, this is the second one. This I labeled as focal lane, this I said is the endometrial canal. Why? Because see here it is appearing to be as a globular mass, the same appearance as that of this focal lane. Now the trick is you give a sweep to the probe and it changes its shape and communicates with the rest of the endometrial canal. See, this is the same area giving appearance like that of the focal lane, but and when I give a sweep to the probe, move the probe, it becomes continuous with the rest of the endometrial canal. So be careful in such situations. This is the endometrial canal, and this is the focal lane in this particular case. Now I'm going into transverse section. Now in transverse section, again, one may get misguided by the fact that there is maybe this focal lane. Regarding the focal lane, and the procedure is same. Yes, this is the focal lane, this is the endometrial canal. Now to prove it to be it as an endometrial canal, give a sweep of almost 90 degrees, and you can see it changes its shape. Now this is cervix, this is vagina, and you can see that the rest of the ultrasound is unremarkable regarding the uterus. And now there is a solid mass measuring 36 into 37 millimeters, and okay, now let's see what's the vascularity of this mass. You see, these are the iliac vessels, left-sided. The ovary is not identified, and this is a solid mass relating to the left ovary, which is not vascular. And when I give a sweep to the probe again, it retains its shape and it does not change its shape. So this is a rounded left ovarian solid mass which is almost in contact with the medial wall or the anterior wall of the uterus. See the pulsations from the vessels. These are vessels surrounding the lateral margin of this given mass, possibly relating to the left ovary, as left ovary is not identified otherwise. And now this is in fact keeping in view the appearance of the myometrium. You see, these are all vessels These are all vessels. These are all vessels. These areas are vessels. The largest one among these measures 7.3 mm, and this finding is almost consistent with the chronic pelvic congestion syndrome. See, these are all vessels. The area that I was showing you are all dilated basilar vessels. These are basilar vessels. And now here comes the right iliac vessels. These are the right iliac vessels. And here we come towards the uterus. So this is a case of ovarian fibroid, solid ovarian mass, this one with pelvic congestion, chronic pelvic congestion syndrome. See the dilation of the basilar vessels, and plus there is a solid area, echogenic in the center and surrounded by a halo in the posterior myometrium, which is consistent with a fibroid with no vascularity seen within it. And this is inconsistent with fibroid. So see here, let me show you. This is the right ovary. This area, I have magnified the view. This is the right ovary, and you can see the the developing follicle within it. These are all developing follicles within it. This is the right ovary. This is the left ADNEXAL. It's not possible to still, I do not see any, I cannot get to the, and this is our case of the day. Thank you very much.